Hi everybody out there. I hope this video finds you well. I know everybody's busy, so I will try to keep this video as short as I can. What I wanted to do was create a video that will demonstrate how to create a screw-retained, implant-supported provisional using a flipper. I believe this method is a drop-dead, straightforward, and easy way to give a patient an immediate solution to missing teeth. However, there's a certain amount of confusion out there on how to provide this solution. But basically, all we're looking to do is knock some holes into a flipper and lute some acrylic to some metal posts. Then trim up the acrylic to make it look like a bridge. Now, I hope that doesn't seem too hard to everybody. And I know that every general dentist can do this. But like a lot of other procedures in implant dentistry, the nitty-gritty nuances of certain techniques and the exact parts and pieces and item numbers are a big source of confusion and mystery. I put this video together to try to resolve some of that mystery. So just to begin, a quick word about the advantages of this procedure. Number one, the flipper can provide for superior pink and white aesthetics. And this is very often an immediate improvement which creates high patient satisfaction levels. The second advantage is the posterior borders of the flipper allow you to stabilize the flipper as you prepare the holes in the prosthesis. You are going to be taking the flipper in and out while you make adjustments. And so the distal extensions will be resting on the lingual gingiva, giving you this stable and reproducible position as you take the flipper in and out and adjust this prosthesis. And the third advantage is the flipper can be used as a replacement just in case the implant surgery does not go exactly as planned. And let's face it, not everything goes as planned. The biggest challenge with immediate implant temporary solutions is whether or not the implants can be fixated well enough. The implants may not fixate well enough, and we need an effective bailout. So if something does not go exactly as planned during the surgery, the restorative dentist does not have to scramble around to create an effective temporary removable replacement. So let's get right into how this method really works. This is the way I picture it. I remove the teeth, place a couple of implants, place a couple of healing abutments, then suture it up and send it over to your office. The first thing you will want to do is register the positions of the implants using a material like blue mousse. This will help you mark the positions so you can create the holes in the flipper in the correct positions. Once you create the initial holes in the flipper, it is time to screw the non-engaging temporary abutments into the implants. So remove the abutments, remove the healing abutments, and select the appropriate non-engaging temporary abutments. You want to use non-engaging temporary abutments because there is no need to have the temporary abutments engage the lobes within the implant body. This is what the non-engaging temporary abutments look like when connected to the implant fixtures. You can see the ridges in the abutments will allow for retention of the acrylic. You can see how the distal extensions of the flipper help to position the prostheses in a reproducible fashion. Now, you can hopefully see what the idea is. You want to create enough relief in the flipper to allow for the correct volume of acrylic to engage the abutment. This is probably the hardest part of the procedure. You do not want to create too large of a hole because that will weaken the acrylic or knock a tooth off the flipper. But at the same time, if the hole is too small, you will have difficulty flowing the correct amount of acrylic around the abutment. This may result in a less than spectacular union between the abutment and the acrylic. The result will be an abutment that moves or spins after the acrylic is placed and allowed to cure. I would say making the hole too small was the most popular mistake made in the hands-on course that I gave to about 25 general dentists. Too many restorative dentists were trying to create an exact hole for the temporary abutment. In this example, you can see on the left temporary abutment, a little more relief would have been desirable on the straight buccal, maybe a little on the distal buccal. The abutment on the right-hand side, you might want to take away just a dash of acrylic on the mesial buccal of that abutment. Once you have the proper amount of relief, Then it is time to lute the abutments to the flipper. My recommendation is to use these special guide pins to hold the temporary abutments to the implant fixture. This will create a very easy way to disengage the temporary abutment from the implant fixture. They are that much taller than a temporary abutment, which makes them easy to find when you flow the acrylic around the temporary abutment. In addition, these guide pins prevent the acrylic from going down into the temporary abutment. Once these guide pins are in place, it will be important to dry the abutments right before you incorporate the temporary abutments into the flipper. This will help ensure good incorporation of the acrylic into the retentive grooves of the temporary abutments. This brings us to the second biggest mistake that I observed during the hands-on course, and that was not using the correct acrylic powder to liquid ratio. Some people made the mix too thin, and some people made the mix too thick. Unfortunately, you have to be a bit like Goldilocks when you do this, and I would say that the correct ratio is somewhere in the middle, and it needs to be a bit on the loose and doughy side, as I demonstrate here. Once you have the right consistency, the acrylic will be loaded into a disposable Monoject syringe. You will probably find it helpful to cut the tip of the syringe by about 3 to 6 millimeters, depending on how much relief you have around the temporary abutments. You can see here what I would consider an appropriate mix. You can see that it is a bit on the loose and doughy side. This will allow for maximum contact of the acrylic to the temporary abutment. You can see here what happens if there is an inadequate amount of relief around the abutment. Without enough space between the flipper and the abutment, you may have difficulty getting an appropriate amount of acrylic in contact with the abutment. The acrylic is forcefully injected around the entire circumference of the abutment. Remember, you need enough acrylic to engage the abutment, but you do not want to overdo it in such a way that the acrylic goes all over the place. You can see how the assistant tries to keep the abutment dry while the acrylic is injected around the abutment. Hopefully, you can appreciate what happens if the powder-liquid ratio is too thick. You will not get the correct amount of acrylic to engage around the abutment. I would say that the powder-liquid ratio in this example is a bit on the thick side and could have been more thin. You can see here how the added height of the guide pins helped make it easier to unscrew the abutments from the implant fixtures. There are a few ways to make sure you don't get acrylic in the unigrip access holes. Some people will use wax or impression material, and some people just take the tip of the unigrip driver into the hole while the acrylic is setting up. Once the acrylic has cured around the temporary abutments, it is time to loosen the guide pins and remove the prosthesis. Here you can see how the acrylic has successfully engaged the temporary abutment. At this stage, you want to make sure that the abutments do not wiggle or rotate. Once you make sure that the abutments are locked into the acrylic, it is simply a matter of adding more acrylic to the abutments and filling in any voids. Then, reduce the bulk, finalize the contour, and do some polishing. Hopefully, that did not look too hard, and you can see the merits of this procedure. I want to tell you that I had fun making the video, and now I feel like I will be able to refer a restorative dentist to this video to clear up any confusion on how to fabricate this type of interim prosthesis. I hope this video provides another tool to add to your toolbox. I realize there are other ways to render this treatment, but I believe this treatment gives the best result without a significant risk of prosthetic complications to the restorative dentist, especially those restorative dentists who are new to immediate temporization. There will be another video, and in this next video, I will discuss what the restorative dentist has to do at the time of insertion to ensure the success of an immediate temporary. In other words, now that we know how to make it, I would like to review how to insert the provisional to ensure success. In order to do this, I will show how other restorative dentists have fallen short while providing this type of temporary. I will show the shortcomings of these other doctors as a way to reinforce some of the highlights of this video. Lastly, I will show what the surgeon has to do at the time of the surgery to prevent complications for the restorative dentist. Of course, that just may mean you will get the distinct impression that it would be a good idea to refer implant cases to a guy named Brand. Until then, thanks for watching, and I hope you received a large benefit worthy of your time. Your future patients will thank you.